Hello, my name is Dr. Benjamin Olson. I'm a PGY1 at Baycare North Bay Hospital in the Internal Medicine Residency Program. I'm here to talk to you today about my poster entitled Incidental Finding of Ultra-Rare Metastatic Nut Fusion Sarcoma After a Syncopal Event. A little background about this is this is a metastatic nut fusion sarcoma, it's called, and it's exceptionally rare, very aggressive. It's a mesenchymal tumor defined by the NUT-M1 gene rearrangements. It fuses with BRD4 and BRD3 most commonly and creates a chimeric oncoprotein. This then attaches to acetylated chromatin through the bromodomains of BRD4, and this brings in histone acetyltransferase EP300, which further acetylates nearby chromatin. This creates large regions of hyperacetylated chromatin, when we call them megadomains. Within them, transcriptional activators turn on growth-promoting genes like MYC and TP63, and the genes that are involved in normal cellular differentiation outside of the megadomains are suppressed as well. So one of the things that we know about this is that these present as high-grade, undifferentiated disease when it shows up with widespread involvement at the diagnosis. Standard treatments really have not shown a lot of meaningful control. And there are some reports of disease stabilization with multi-tyrosine kinase inhibitors, but they're very anecdotal. We don't have a lot of these cases. So this is why it's a very interesting case presentation to put forward, at least into the literature. So specifically for us, we had an 82-year-old lady with multiple comorbidities who came to the emergency department after she had a syncopal event. She fell forward, developed some right-sided facial bruising, and some new right lower quadrant pain. A D-dimer was run, and it was elevated. So we ran a CT angiogram of the chest, and it ruled out, of course, the pulmonary embolism, but we found multifocal hepatic masses concerning for metastatic disease. The next day, a liver biopsy was performed. Pathology showed epithelioid morphology with monotonous cuboidal cells, moderate cytoplasm, and prominent nucleoli arranged in cords and nests within a reticulin-rich, variably hyalinized stroma. Additionally, the immunostains then demonstrated diffuse greater than 90% speckled nuclear nut expression. So this was considered highly consistent with a NUT-M1 rearranged sarcoma with a mad nut fusion, so strongly suspected. And in the end, it is a bit of a sad story for our patient, given that this has a very, very poor prognosis and the extent of the disease and the fact that we had low expectation that pretty much any of the treatments would do very much for her. She opted to go ahead and pursue hospice services. So we see below here in the pink, we see what we were talking about before with the monotonous cuboidal cells, epithelioid morphology, this is within the liver, and moderate cytoplasm with prominent nucleoli. Moving on to the next image here, we see the nut stain that was actually performed on her cells. And it shows, and you can tell, greater than 90% at least, we have the speckled nuclear nut expression, and we see it most prominently at the nucleoli. Interestingly, we ran the keratin stain, which is right below it, and it's a pan-keratin stain which revealed a negative result. It's very rare to get a negative result with a nut carcinoma because most of these are a carcinoma. So this is one of the reasons that it's so interesting. And it is unusual for nut carcinoma. It's almost all of them, greater than 90% of them would be keratin staining. The absence of this then shifts our classification towards a NUT-M1 rearranged sarcoma rather than the carcinoma. The distinction then underscores really why it's important to do the immunohistochemistry and the molecular testing, especially for these rare diseases, to rule out and to sort of figure out what exactly is going on with the tumor. So specifically, the treatment options, while they're undefined and responses to a lot of the therapies are poor, documenting these keratin-negative nut fusion sarcomas is really important for raising awareness. It also hopefully will help guide diagnostic vigilance and contribute to growing foundation of knowledge for future targeted therapies. Each case, I think, is very important to improving recognition and refining our diagnostic algorithms. Ultimately, we hope that this will help increase our understanding of the disease.